Induction of labor. Most women go in labor between 37 to 42 weeks on their own. Only 4% deliver on the due date. Labor, being a very natural process, is meant to start on its own. Induction of labor is starting labor artificially by giving you medicines. There are various reasons you may be offered induction of labor. Any doctor or a healthcare provider's top priority is the safety of you and your baby. Reasons you may be offered induction are prolonged pregnancy, that is when your pregnancy has crossed the due date. Pregnancy being affected by medical conditions like preeclampsia, that is high blood pressure in pregnancy, diabetes, obstetric cholestasis, if you're carrying twins or triplets, if you're 40 or more than 40 years of age. List for the reasons of induction doesn't end here, but these are the most common indications for induction of labor. If you are not keen for induction of labor and want things to happen naturally, you can always ask your midwife or an obstetrician about the membrane sweep. Membrane sweep is performing an internal examination during which a midwife or a doctor will sweep the neck of your womb using their fingers. It is an attempt to separate the membranes from the neck of the womb. This will help in releasing prostaglandins, which will help in starting labor in 48 hours. It is quite an uncomfortable examination, and you may see a blood-stained mucus discharge after examination, which is considered quite normal. If you don't go in labor naturally after membrane sweep, you have an option of getting membrane sweep done again or straight away going for induction of labor. Different ways are used for inducing labor. Which method is used for you will depend on various factors such as your pregnancy, your medical history, the reason for induction, and the status of your cervix or on vaginal examination. If the neck of the womb or cervix is completely closed and your waters have not gone, cervical ripening is the most common induction method used. Cervical ripening is inserting prostaglandins or a balloon catheter into the vagina. This will help in softening the cervix or the neck of the womb. Cervical ripening can be done either by inserting a prostaglandin tablet or a gel in the vagina, or by inserting a prop as pessary. Pessary is a tablet which is attached to the ribbon-like structure and is kept in vagina for 24 hours. You will be examined after that to see if your cervix has softened or dilated. Prostaglandin tablet or gel is kept in vagina for 6 to 8 hours. You are examined after that to see if your cervix is dilated or not. You may need another tablet or a gel if the neck of the womb is not dilated. Balloon catheter is used in cases where you had a cesarean section before and are considering normal labor this time, or your baby has growth restriction. In these cases, a balloon catheter is a more suitable option as it mechanically stretches the cervix to open it. The balloon catheter is inflated with small volume of water and is then inserted into the cervix. It is then left in the cervix for several hours to stretch it. If on internal examination you are already dilated a bit, then the doctor or the obstetrician may straight away break the waters and kickstart the labor. This breaking of waters is done with a sterile plastic instrument which is known as artificial rupture of membranes. You will see a sudden gush of fluid coming out when your waters are broken. If any of the above said things didn't help, or your waters have already gone spontaneously, and you are found to be dilated, you may be started on oxytocin drip. This hormone is given in drip, and this will make your contractions stronger in intensity, frequency, and duration. You will be monitored regularly if you are given oxytocin drip to make sure that the baby's heartbeat remains normal at all times. Induction is a long process. It is different for every pregnancy. For some, it might be quick, and for others, it might be very long. Generally, it lasts around 2 to 5 days from induction to the birth of the baby. Induction process and opening of the cervix is the longest process. It is longer for those who have never given birth as compared to the moms who have delivered before. Overall, induction is a safe process, but small risks are associated with it. You can get excessive contractions, or baby's heartbeat can get abnormal after induction. If any of this sort happens, your doctor will act promptly, as you and your baby's safety is the priority for any obstetrician or a midwife. If you feel induction process painful, you can discuss with your doctor about the pain relief options. If induction fails or doesn't work, depending on the guidelines of your hospital, you can be offered cesarean section or a repeat induction. You can discuss pros and cons of each with your doctor before making a decision.